Some people are afraid of needles or injections. I wouldn't be nervous about the infusion. It's not hard.
Yeah, it's not that scary. You go and you get the line in, and after the IV line's in and the bag's hooked up, it just takes about 30 minutes. And the infusion center I went to, they had a little TV, so I was able to watch the news when I was getting my infusion done.
Sometimes you end up meeting people who happen to be there at the same time, and it's nice to see those familiar faces again. I made a friend who had Crohn's disease, and we would actually be infusion buddies. So we would schedule our infusions at the same time and then go have lunch together.
So you do have to go in for infusions every 8 weeks, and that little bit of fear and anticipation of having to go in and have a needle stuck in you, the advice is it's all worth it. If this medication works for you, it's worth it.
Entyvio is a prescription medicine used in adults with moderately to severely active ulcerative colitis or Crohn's disease when certain other medications have not worked well enough or cannot be tolerated. Important safety information about Entyvio, vedolizumab. Do not receive Entyvio if you have had an allergic reaction to Entyvio or any of its ingredients. Entyvio may cause serious side effects, including infusion-related and serious allergic reactions can happen while you are receiving Entyvio or several hours after treatment. You may need treatment if you have an allergic reaction. Tell your healthcare provider or get immediate medical help if you get any of these symptoms during or after an infusion of Entyvio: rash, itching, swelling of your lips, tongue, throat, or face, shortness of breath or trouble breathing, wheezing, dizziness, feeling hot, or palpitations. Feel like your heart is racing. Entyvio may increase your risk of getting a serious infection. Before receiving and during treatment with Entyvio, tell your healthcare provider if you think you have an infection or symptoms of an infection, such as fever, chills, muscle aches, cough, shortness of breath, runny nose, sore throat, red or painful skin or sores on your body, tiredness, or pain during urination. People with weakened immune systems can get progressive multifocal leukoencephalopathy, PML, a rare serious brain infection caused by a virus. Although unlikely while receiving Entyvio, a risk of PML cannot be ruled out. PML can result in death or severe disability. There is no known treatment, prevention, or cure for PML. Tell your healthcare provider right away if you have any of the following symptoms: confusion or problems thinking, loss of balance, change in the way you walk or talk, decreased strength or weakness on one side of the body, blurred vision, or loss of vision. Liver problems can happen in people who receive Entyvio. Tell your healthcare provider right away if you have any of the following symptoms: tiredness, loss of appetite, pain on the right side of your abdomen, dark urine or yellowing of the skin and eyes, jaundice. The most common side effects of Entyvio include common cold, headache, joint pain, nausea, fever, infections of the nose and throat, tiredness, cough, bronchitis, flu, back pain, rash, itching, sinus infection, throat pain, and pain in extremities. These are not all the possible side effects of Entyvio. Call your healthcare provider for medical advice about side effects. Before receiving Entyvio, tell your healthcare provider about all of your medical conditions, including if you have or think you may have an infection, or have infections that keep coming back, have liver problems, have tuberculosis, TB, or have been in close contact with someone with TB, have recently received or are scheduled to receive a vaccine, or if you are pregnant, breastfeeding, plan to become pregnant, or plan to breastfeed. Please see accompanying full prescribing information, including the medication guide for Entyvio, and talk with your healthcare provider. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Uses of Entyvio, vedolizumab. Entyvio is a prescription medicine used in adults for the treatment of moderately to severely active ulcerative colitis, moderately to severely active Crohn's disease,